Do you know the signs of diabetes that can appear at night? This is a question that might not come to mind regularly, but understanding the symptoms of this common yet serious health issue can make a difference. Today, we explore the subtle yet significant signs of diabetes that often appear at night. These nocturnal indications offer valuable insights into potential underlying health problems. First of all, one of the earliest symptoms of diabetes is usually an increase in urination. If you wake up several times during the night to empty your bladder, your sleep pattern could be disrupted, which might be a sign of diabetes. This happens because when you have diabetes, excess sugar or glucose accumulates in your bloodstream. Your kidneys have to work extra hours to filter and absorb the excess sugar. If the kidneys can't keep up, the excess glucose is excreted in the urine, drawing fluids from your tissues, which increases the frequency of urination. This physiological response is your body's attempt to eliminate the excess sugar and can be a warning sign of diabetes. Secondly, night sweats are another crucial symptom to pay attention to. If you frequently wake up in the middle of the night sweating, this could be an indicative sign of diabetes. Night sweats often occur due to low blood sugar levels during the night, known as nocturnal hypoglycemia. This happens when your body releases emergency hormones in response to low sugar levels, causing excessive sweating. Adjusting medication doses and eating habits can also help manage night sweats in diabetics, but these changes should only be made under professional supervision. Before moving on to the next symptom, don't forget to like and subscribe. Thirdly, symptoms of hypoglycemia, including not only sweating and shaking, but also a noticeable increase in hunger, can occur at night. These can include confusion, blurred vision, and even heart palpitations. Hypoglycemia, or low blood sugar, is a condition more frequently associated with diabetes. The reason these symptoms appear mainly at night is due to the body's need for energy while resting. When glucose levels drop, the body responds by showing these symptoms to signal the need for an increase in blood sugar. Managing these symptoms involves regular monitoring of blood sugar levels and a balanced diet. Additionally, it's crucial to discuss any medication with health professionals, as some drugs can affect blood sugar levels. In some cases, a nighttime snack containing complex carbohydrates and proteins may be recommended to keep blood sugar levels stable during the night. The fourth sign is restless leg syndrome, a neurological disorder often underestimated but quite widespread. This condition is characterized by an uncontrollable and irresistible need to move the legs. This urge is usually accompanied by strange and uncomfortable sensations deep in the legs. These sensations, difficult to describe, have been compared to aches, tingling, or even a feeling of crawling. Now, you might wonder about the link between this syndrome and diabetes. The connection lies in the nerves. A persistently high blood sugar level, characteristic of diabetes, can damage the nerves in your body over time. This condition, known as peripheral neuropathy, is a common complication of diabetes and can lead to the development of restless leg syndrome. Damaged nerves send conflicting signals to the brain, leading to the sensation of constantly needing to move your legs. So if you feel discomfort or an irresistible need to move your legs, it might be a good idea to check your blood sugar levels. The sleep disorder called sleep apnea occupies the fifth spot on our list. It is a sleep-related condition characterized by frequent pauses in breathing during sleep. These pauses, or apneas, can occur multiple times during the night, resulting in intermittent sleep and often leaving the individual feeling tired the next day. The relationship between sleep apnea and diabetes is particularly notable. Scientific research has shown that people with diabetes, particularly type 2, are much more likely to have sleep apnea. The reason behind this is multifaceted. a key factor is that both conditions are associated with obesity. When excess fat accumulates around the neck, it can obstruct the airways, leading to sleep apnea. Additionally, the metabolic alterations caused by diabetes, such as insulin resistance, can directly contribute to the development of sleep apnea. Insulin resistance can cause imbalances in the body's energy consumption during sleep, leading to interruptions in breathing. It is this complex interaction of factors that leads to a higher risk of sleep apnea in people with diabetes. Continuing, we reach the symptom of increased thirst, also known as polydipsia. If you wake up frequently at night with a dry mouth and feel unusually parched, this could well be a revealing sign of diabetes. This occurs due to high blood sugar levels, which force the kidneys to work extra hours to filter and absorb the excess sugar. When they can't keep up, the excess sugar is excreted in the urine, drawing fluids from your tissues. This leads to more frequent urination, which can dehydrate you, hence the increased thirst. Managing this particular symptom involves controlling blood sugar levels, regular monitoring, a balanced diet, regular physical activity, and medications prescribed by your doctor. It's essential to consult your doctor for the best ways to manage your symptoms. Don't ignore increased thirst, especially if it's accompanied by other diabetes symptoms, because it's your body indicating that something is wrong. The seventh signal to pay attention to is fatigue. If you feel constantly tired despite getting essential hours of sleep, this could be an indication of diabetes. The fatigue associated with diabetes is caused by the body's inability to effectively use glucose as an energy source. When your body can't convert food into energy due to a lack of insulin or insulin resistance, you may feel tired all the time. This is because the cells are deprived of glucose they need to function optimally. Managing the fatigue associated with diabetes involves maintaining stable blood sugar levels, which can be achieved through regular physical activity, a balanced diet, and regular checkups with your healthcare professional. It's important to ensure your body gets enough rest and that stress levels are kept to a minimum. Relaxation and stress management are also crucial for managing fatigue associated with diabetes. Dry mouth, medically known as xerostomia, is another notable symptom to be aware of. Characterized by an absence of saliva, individuals may wake up frequently with a dry mouth despite maintaining adequate hydration levels. Potentially, this could be a sign of diabetes. This symptom occurs because high blood sugar levels can decrease saliva production, causing dry mouth. High blood sugar levels can also lead to increased urination, which can cause dehydration and subsequently dry mouth. Managing this symptom involves maintaining good oral hygiene, staying well hydrated, and using saliva substitutes or stimulants if necessary. Chewing sugar-free gum or sucking on sugar-free candies can also help stimulate saliva production. It's always recommended to consult with a healthcare professional for an accurate diagnosis and treatment of this condition. The last point to consider is the onset of sleep disorders. If you suffer from insomnia or face other nocturnal issues, these might be related to diabetes. Chronic sleep disorders are often observed in people with diabetes due to the body's inability to regulate blood sugar levels, causing nocturnal hypoglycemia or hyperglycemia. Low blood sugar levels or hypoglycemia can trigger symptoms like sweating and shaking, which can wake you up in the middle of the night. On the other hand, hyperglycemia or high blood sugar levels can lead to frequent urination, causing multiple trips to the bathroom at night. Managing these sleep disorders generally involves improving blood sugar control through medications, dietary changes, and exercise. Therapies like cognitive behavioral therapy can also be beneficial for combating insomnia. Therefore, if you have trouble sleeping, it is essential to consider the possibility of diabetes and consult a healthcare professional for an accurate diagnosis and treatment. In summary, the signs of diabetes that can appear at night include frequent urination, night sweats, symptoms of hypoglycemia, restless leg syndrome, sleep apnea, increased thirst, fatigue, dry mouth, and sleep problems. Remember, these symptoms are not definitive proof of diabetes, but can indicate the need for a medical consultation. It's always best to consult a healthcare professional if you experience any of these symptoms. Diabetes is a disease that affects millions of people worldwide. Being aware of the signs, especially those that occur at night, can help with early detection and treatment. Don't forget to like and subscribe if you liked the video.